In order to promote a fair process for vaccine administration while vaccine supply is limited, the Illinois Department of Public Health is requiring all providers to help ensure that vaccine recipients self-verify their eligibility for the applicable prioritization group. Self-verification ensures the recipient truthfully indicates, verbally or otherwise, their specific category of eligibility to receive the vaccine. Providers, as a best practice, will also request documentation or proof, such as personal identification or employee verification, to confirm the individual is in the priority population being served. Considerations for acceptable documentation includes a state ID or driver's license, U.S. or foreign passport, a consular ID, temporary visitor driver's license, or a city key card. Providers may not ask individuals to provide documentation regarding their immigration status. For essential worker verification, work identification or badge, paycheck stub, or a letter from the employer are acceptable. If the individual's specific job title is not included on the list of settings or job titles, but the individual's position is aligned with the priority population description, please go ahead and vaccinate them. Let's also remember that basic principles encourage non-discrimination and reduce barriers to vaccine. All populations in Illinois can receive the vaccine regardless of insurance coverage or immigration status, including individuals who are undocumented. Again, providers may not ask individuals to provide documentation regarding their immigration status. When it comes to billing, any provider communication with the public, such as pre-screening for an appointment, website information, or pamphlets, should indicate there is no copay for individuals with insurance and no cost for people who are uninsured. If you need information on reimbursement for vaccine administration for people who are uninsured, refer to the HRSA COVID-19 Uninsured Program at hrsa.gov/COVID uninsured claim. Remember, vaccine administration fees recognize the costs involved in administering the vaccine, including the additional resources involved with required public health reporting, conducting important outreach and patient education, and spending the additional time it takes with patients to answer any questions they may have about the vaccine. No visit fees should be billed unless the patient has a vaccine-related complication that requires medical assessment, or if the patient is seeing you for another reason besides pandemic vaccination.